Welcome to the AI Shift podcast. Today we are interviewing Dr. H.K Chopra. Dr. H.K Chopra, can you please give a brief introduction about yourself to the audience?
I am Dr. H.K Chopra, Chief Cardiologist at Moolchand Hospital, New Delhi, India. I'm working here for the last 46 years.
So, Dr. H.K Chopra, can you walk me through how AI has entered your day-to-day work over the last few years? Like, when did you first use an AI tool here at Moolchand?
I think it's a very important question, Omar. AI has really enhanced the potential of HI. I feel that usefulness of AI should be appropriate in the patient care. When it was my first term, I just tell you an example. I was reviewing my own data through EMR. And
what's EMR?
It's a electronic medical record.
Okay.
And in the medical record, I was seeing for the last 7 years or 8 years one of my patients, Mr. R. Anand. And he had a hypertensive. He came to me with impending depression.
Impending depression?
Yes, and I found his blood pressure was too high, 210 by 120. And he had marked tachycardia, palpitation. His wife accompanied him, his 2 daughters accompanied him. And they were quite concerned and worried because he's just 44-year-old and working as CEO in HCL. And I'm seeing for 7-8 years, I'm seeing his record, how he's doing well. So AI gave me the information within minutes. His 7 years record retrospectively, including his symptoms, including his examination, including his lab reports, including my prescription.
Wow.
And the follow-up data. So within a minute, you're getting a data. What else you want as a doctor? In the older time, I used to go to the record section, pull up the files, and devote so much of time. So to get the data instantaneously for one patient like this,
yes.
If I have 100 patients, I can produce a huge, significant global impact.
And it saves time also, and it's more efficient also.
More accurate.
So this should be like, is this the biggest task that has become easier for you with the implementation of AI, or is there another example which you can think of, which because of AI has become easier? Then it was harder before and become easier now.
I think I'm basically a writer. I've read 55 books.
Wow.
And initially, I used to think about the TOC, table of contents. And now, I just don't think of table of contents. I just think about the topic for my book. And I feed in what should be the appropriate table of contents to impact globally. And I get everything within that time. So it is not making me passive. It is making me more charged.
So AI is basically helping you summarize large pieces of information, which makes it efficient for you to analyze and use it for your own personal use, basically.
Absolutely.
So my first question would be towards you, would be like, so cardiac emergencies are very time critical, obviously. Walk me through a case where AI helped you spot a risk or a blockage earlier than you normally would have.
I think, Amar, it's a very important question which you asked. A lot of patients, I suspect when they come to me with chest pain, and I'm not sure are they going to be positive or not. I get their AI-powered CT angiogram in our hospital now.
AI-powered CT?
CT coronary angiogram.
Angiogram, okay.
And the CT-powered coronary angiogram will give me an idea as to what is the calcium score.
Okay.
In that particular individual. One.
Wow.
And what is the degree of blockage in the coronary arteries? Whether it's a right coronary artery or a left coronary artery,
yes.
or even the branches. So it helps me to follow the line of treatment, whether it should give only medical treatment, or it needs intervention, or it needs a bypass surgery, or it needs only prevention. I think AI has a revolution from evolution.
Yes.
And it's game changers. But we should always take pros and cons, because AI ethics is very important. If you follow the AI ethics meticulously, so we don't commit much mistakes, much errors. If you ask my personal opinion, accuracy is very high.
Yes.
Very limited errors.
Yes.
And time faster.
Much faster.
Much faster.
Yeah.
Much faster.
Time efficient.
Yeah, it's a time efficient. And at least we are very, very accurate, we are
Yes.
very precise and personal. It's a personal information. And we can generate the report within no time for a patient. They don't have to wait. He doesn't have to come for a second time to collect the report.
Yes.
And the report will come directly on his mobile phone.
Wow, that's very
Including the picture.
fascinating.
Including the picture. You can see the NGO. And you can see the real time of an NGO. So what else you want?
Going back to my previous question, can you walk me through a real life emergency case that happened under you, and what was the use of AI in that emergency case? It must have been very time critical. It must have been very fast. So how did you use AI? Can you walk me through that case?
I think this is a very, very pertinent question to our specialty, because heart attack is an emergency.
Yes,
And time window is very important.
of course. Yeah.
What we call as the golden hour. And the golden hour is 60 minutes or 90 minutes. Any patient who had classical symptoms of a heart attack, and we know clinically that he or she has a heart attack, so time window should be considered in mind straight away. And our emergency should have a red alert that as soon as the patient is coming, and they must have a complete protocolized way of treatment, which should be AI driven, time bound.
AI driven.
AI driven, of course. That within 30 to 60 minutes, everything should be done. EKG, AI powered, echo, AI powered, lab, AI powered, and of course, we must have the diagnosis AI powered. So diagnosis, prognostics, and therapeutic intervention all should be AI powered. In therapeutics, we must subject the patient immediately either from door to injection time or door to balloon time. So we know exactly optimize that this patient has been subjected to an optimum treatment of 90 minutes. And we can even see the plaque or even the clot which is blocking the coronary arteries and see the success of it. So I think right from the inception up to the procedure, up to the outcome, up to the output,
Everything is AI. So AI. So you can say that AI has revolutionized healthcare. Significantly revolutionized
I
it.
use the word, it's a game changer.
So can AI help you identify high-risk patients before they need emergency surgery? So are you using AI for prediction or prevention?
Yeah, I think it's a very good question, because the AI has a power of prediction.
Okay.
What should they predict? Predictive score of an individual. For example, if a person is obese, we can say which is the obese phenotype. And also, we can see what is the extent of dyslipidemia or high cholesterol. The bad cholesterol is high, the low cholesterol is high, as per the guidelines. Similarly, sugar control. Is it controlled properly or it is not controlled properly? We can make out. Similarly, a lot of inflammatory markers, like what we call biomarkers,
Yes.
like CRP,
Yes.
or we also see IL-6, or we see D-dimer, or we see lactate levels. These are all the markers which statistify that this particular patient is a high risk, moderate risk,
Yes.
or low risk. It helps us a lot.
So I can conclude that based on the previous conversation that AI does prediction and prevention both, because it predicts by giving the markers, and it prevents because during the surgery it's much very time efficient, gives you stability, it gives you more time to process. So we can say it helps in prediction and prevention both.
AI, I agree with you, is of a great help in prediction, in diagnosis, in optimization of the treatment, in prognostication of the treatment, and the outcome of the patient, and even the follow-up. I can see this patient remotely. For example, patient come to me from Kathmandu.
Yes.
I got all the things done here, but I have to follow this patient by remote control, by having his blood pressure monitoring, by having his pulse monitoring,
Yes.
and sugar monitoring, and prescription can be transferred to me in my mobile phone, and I can advise him accordingly. This is all AI driven.
So AI has helped you in every step of the way, basically.
Absolutely.
So that brings me to my next question. So you use the AI CD system here, and when the AI reads the scan and you read it, how often do you agree? Like, has there been a case where you disagree with what the scan has shown? And has there been a time that AI has caught something you have missed, or you caught something the AI missed? So, like, can you give an example?
Very good point. I think I worked a lot in US.
Okay.
And I worked in the University of California for almost 9 years. And I was also in the University of Alabama in Birmingham. So I was doing a lot of research projects. So there is a lot of intra-observer variability. Intra-observer variability.
What does that mean?
I do a scan and I see a scan once.
Yes.
And then I see a scan second time.
Okay.
So there will be some variation in me. It's called intra-observer, means within one observer.
Okay.
Then there is the inter-observer variability. If I see something in a scan,
yes,
and you see something in a scan, there is a variability between you and me.
Yes.
AI has no thing like this. There is no variability or minimal variability. So that's a very big potential of AI.
So AI, in your years of experience, AI has never made a mistake in giving the correct diagnosis or doing the correct AI CT scan. AI has never made a mistake until now.
No, I can't say never, but we say very minimal chances.
Minimal. But those minimal chances could be life-threatening to many patients also. So then in those cases, have you been able to spot those mistakes correctly in the right time?
I think this is also a very important question. Whatever AI sees, HI monitors.
Okay, what?
Human intelligence monitors human intelligence and decides. So ultimately, monitoring and decision taking is the power of HI. So you know the patient. Machine doesn't know the patient. So you have to use your wisdom as to how I can manage this patient meticulously. Whatever is the report of AI is okay, is fine. But ultimate wisdom is HI. Because the creation of AI is by HI. So I call AI plus HI is augmented intelligence. Also, AI plus HI is SI. SI means super intelligent. So who becomes super intelligent? HI becomes super intelligent.
Got it.
So it enhances the intelligence of HI if you use AI, though all the information AI took from HI only, but consolidate in a very efficient way.
So, like, this is a hard question. Like, let's go through a scenario. Like, let's say an AI system flags a blockage, and by some chance, you or some other person, they miss it. When patient has a heart attack and the patient dies, who is responsible for that? Is the AI maker responsible? Is the doctor responsible? Is the hospital responsible? So, can you just give a brief explanation on that?
I think it's a very important question, what you call it a legal question. If a patient comes to us and when he came, he had a severe chest pain, and we see the angiogram and we find the patient had a blockage, and we find it's 99% blockage.
Yes.
But by the time we open by angiogram, by intervention, we find that there is no clot inside.
Yes.
So basically what we're seeing is the blockage.
Yes.
Was not a clot, but was a spasm.
So you missed it, and that caused
the spasm mimics like a clot.
Okay.
Patient died.
But
you have to prove that this patient was more likely to have the spasm for the obvious predisposing risk factors. What we call is a prismatic angina. Prismatic angina means where the ECG showed a marked ST elevation, mimicking as a heart attack, but in fact it is not heart attack, it's an unstable angina.
Yes.
But the conversion of unstable angina to a heart attack or sudden death can be 5% or 3%. So legally I'm sound if I have wisdom to decipher. But if I'm succumb to AI, then you will go. HI has to be superb. So you have to be master.
So basically what I'm understanding is that if suppose the patient dies in this case, the humans, they have to be responsible. They're the ones who are responsible for this, because the humans cannot rely on AI. They need to make their own. AI is a thing that's going to help the humans, but the humans have to use their own brain and intelligence to make the correct diagnosis and prognosis. Basically,
as I mentioned to you, augmentation is by AI, but HI is superb. Decision making
is all by humans.
Monitoring, intervention, what type of intervention, all has to be decided by HI, human intelligence.
So then, like, there must be many myths surrounding this, because I'm seeing like many people, they worry robotic surgery is less safe than a surgery done by humans. And like surgery done by AI, they also be very worried that this might not be the correct, like there might be mistakes. So what's your take on this? And if you had to like tell the patients and you have to like comfort them, what would you say to them?
Very good question, Amar. In the era of digital media and the era of AI, if any doctor
Yes.
who is an orthopedic surgeon, if he's trained on robotic surgery, we call him as a smart orthopedic surgeon, because the power and the potential of AI is superb by robot, because the robot is very precise, accurate, time bound, less bleeding, quick recovery, quick sent home, and the monitoring is not much required, rare complications. So overall, the benefit of AI are more as compared to HI. Say orthopedic surgeon is about 70,
Yes.
whose hand may tremble at times. Here there's no question of error like this.
Okay.
The accuracy rate is very high. So I personally feel if I get an orthopedic problem,
Yes. You would want to
I
done
would
by
like to get a robotic done, because I know
It's
robotic surgeons are smart surgeons.
Okay.
So all people who are using AI are smart hospitals, smart lab, smart doctors, smart faculty, and smart people. And they should develop as the smart doctors of the world,
Okay.
and globally. So AI is definitely smart, but the only thing is ultimate wisdom should be of HI.
So you said about how it makes the incisions much easier, much smaller. It makes it's not, you don't need like a wide open, like it's much more easier, more efficient. So does that also have an effect in the patient recovery times? Like, does it reduce pain? Does it reduce swelling? Are they able to go home faster? Are they able to walk faster? Like, can you give an overview on that?
I think any patient who undergo surgery by robot, his stay in the hospital is very short. And number two, pain is minimum.
Pain is less compared to before? Minimum pain.
Hardly. And then the incision size is very small. And then the bleeding risk is very low.
Okay.
And they're discharged quickly from the hospital.
Yes.
And the recovery rate is also faster. So overall, if I say, it is much more superior technology and a smart technology as compared to the conventional orthopedic surgery. Not only in India, but in the globe. Whether it's a gynae or general surgery or orthopedic surgery
Cardiology.
or even neurosurgery, or even now they are making a robotic PCI, robotic percutaneous intervention, robotic eye surgery.
Wow.
Where are they going? I remember a patient of mine
Yes.
who had a small, tiny lesion
Yes. Yes.
inside the brain.
Yes. Yes.
So they used the robot. They went through a hole inside the nose and they removed it within 15-20 minutes. And they came to know it was a fibrous tag. He was a 40-year-old doctor in San Francisco. I cannot imagine all these things sitting here. So what I mean is, more refinement you have, more accurate you are, and more is the success rate. So AI has tremendous potential. One limitation is there.
Yes.
I think we should know that some legal issues, one you raised already, and the second thing is AI ethics should be regulated.
Can you elaborate on what AI ethics
When I
means?
say AI ethics means, for example, so many wars are taking place now.
Yes.
They are AI driven.
Yes.
Whether it's
But can you give it in a medical field? Like, what are the ethics a doctor or person needs to follow in the medical field? Like,
see, for example, they should not be sharing of any records
okay,
by AI to anybody else.
okay,
Because my skill is separate, totally. Like a Supreme Court lawyer. There are 2 lawyers or 3 lawyers. They are all are lawyers. Basically, their skill is different. Similarly, the doctors have a different skill. So we should not share our documentation or our record open to another doctor or another organization. So then become unethical.
okay,
Because it has got the loopholes and you can fall victim to litigation. To prevent litigation, secrecy and privacy has to be preserved. See, for example, if in a family, father got operated and his two sons,
Yes,
and there is some property matter. So we are not bothered about the property matter.
of course.
But if something happens, one son says why it was done, another son says why it was not done. So we don't want to fall victim to all. I see every day. So all this secrecy, privacy
Is very
be
important.
maintained and should be consented before the procedure.
Yes.
Somebody is to sign it.
So do you think like India, in terms of government hospitals, private hospitals, and the implementation of AI, do you think that the majority of them are following the ethics of using AI properly? Like, are they following the codes of conduct?
I think so far as the medical fraternity is concerned, it's very good, okay.
They're following it.
Yeah, but the only thing is when there are medical legal issues,
Legal issues. Yeah.
yeah, family infected or due to something or the other,
Yes.
then the doctors on the other side become different.
Okay.
And then there are real problems because some doctor is backing them and some lawyers are backing this side to me.
Got it.
So that has to be taken care of. It's still everywhere. So I think that is the only issue. And second important ethics is this should be regulated. Central body should regulate. This is what is permissible, this is not permissible. So there should be some limits. It shouldn't be used haywire by anybody,
course.
anywhere, any organization. So there should be some like we have FDA, for example.
Yes.
Any drug comes in the market, it needs to be approval. Any
course.
trial, it needs to be approval.
Yeah.
The same way in India, we have ICMR, Indian Council of Medical Research, or World Health Organization, or Drug Control of India. So there is a regulatory body. So I think as we evolve over a period of time, I think a regulation of AI is a must to go further. I believe today I'm talking to you vocally,
Yes.
locally, it should impact globally. Whatever you are doing in podcast with me, as Amar Talwar, should go to the whole globe. That this is what's going to be in the present and what's going to be in the future, and we should not be fear. And doctors should not be scared that they will be out of job. No, they don't push out of job.
Okay.
On the contrary.
That's another myth I was going to come to.
Yeah.
Because I was reading like a lot of doctors, they're fearing that because of the implementation of AI, their jobs are going to go. But what they're not understanding is that humans will still have to supervise AI at every single step of the way.
So we have to supervise, we have to monitor, and we have to be decision taker. So our job will become easy on the contrary.
Easier, but not, you won't take away your job.
No,
it will
not
become
at all.
easier, make more efficient.
It's a wrong thinking. So according to me, we should be very positive that we are going to be a smart doctor, a smart cardiologist. In fact, in my opinion, there should be a smart heart clinic at Moolchand City. There is one doctor here, I don't want to name, who runs a clinic. They say diabetes care or diabetes clinic AI powered. So they are marketing themselves
Yes.
as we are smart diabetologists. The same way we have to be a smart cardiologist, smart orthopedic surgeon, smart hospital, smart lab, smart everything. And it's feasible, possible if we think like that. So it's evolution to revolution
Yes.
and the game changer for the future.
So that brings me to my concluding question. So, where do you see AI taking your field over the next 5 to 10 years? Like, where do you, like, AI has obviously evolved so much already, but where do you see it evolving your field even more in the next 5 to 10 years? Like, many people wonder, like, will humans stop doing surgeries? Will the AI robot do the entire surgery? So, can you, like, give me an overview on what you think will evolve in the next 5 to 10 years?
I think in the next 5 to 10 years, the AI will further evolve.
Okay.
And this will become a very smart AI. For example, I'm telling, for example, education. Education by various apps, as well as by creation of guidelines or by trials. I remember when I used to see trials, I'll take hours together to find the trials in the last 5 to 10 years.
Exactly.
Here I had to just press a button and within no time I get all the trials, including the name of the author, everything. So it will become very quicker and accurate and faster so that I can go further and very fast.
Got it.
For example, I was just going through and writing an article on AI in hypertension.
In hypertension.
In hypertension.
So, if for viewers who don't know, can you explain what hypertension is? And
So hypertension is increase in the blood pressure.
okay.
when the blood pressure increases, how can AI help us?
Okay.
So the AI guides the person. If you really want not to fall victim to any complication of hypertension, please check your blood pressure daily. Your ideal blood pressure should be this much. This is known as the HBPM, home BP monitoring. If you are still symptomatic, your blood pressure is high, kindly go for following tests. Then it says, if you find something abnormality, please see a doctor. Ultimate decision of a doctor. And if you find still there is a problem, you go for ABPM. ABPM is an ambulatory blood pressure monitor. That means 24 hours, what is your blood pressure variability? And accordingly, you go to a doctor so that you don't fall victim to a heart attack, brain attack, leg attack, eye attack, and abdominal attack. So everything you learn within 1 minute.
So you're predicting that AI will evolve so much that it'll be able to predict what your condition is much before a doctor or another human will be able to do it. So, and by predicting it, it helps to save a lot of lives because it'll inform the doctors before, and that will help make it more efficient and better for the patient and for the doctor.
We will reduce the morbidity, we will reduce the mortality,
Yes.
and enhance longevity. What else you want?
That's a great ending towards this podcast. Thank you so much for meeting me, doctor.
Thank you, Amar.
Grateful to have you here.
It's a great pleasure.
Great pleasure. Thank you.